Experts are warning as many as 200,000 New Zealanders could be affected by long COVID just from the first wave of Omicron. It's been 3 months since case numbers really started ramping up. Some people still haven't recovered. Health correspondent Lucy Warhurst reports.
Ryan Johnstone is a 32-year-old fully vaxxed, career-driven 5K run a day kind of guy. But 11 weeks on from getting COVID, he's still struggling with debilitating symptoms.
It's insomnia, it's heart issues, it's neurological issues with my thinking and my memory.
He tried to go back to work, but it's forced him to ask for a career break.
I work a fairly demanding job where I've never normally take 1 to no sick days a year, and I've now been forced to be off for like 2 months, and I don't know how much longer I'm going to need. It does take a toll.
It's not until he's had symptoms for 12 weeks that he can be diagnosed as having long COVID, and there's no financial support.
My wife's pregnant at the moment, and it's quite a stress at the moment when, you know, I'm not well.
He feels alone, but he's far from it.
The rate of long COVID will probably be at the lower end. So 10% of the estimated 2 million people that have had COVID in this country, that's 200,000 people who are likely to be affected to some degree by long COVID.
3 months on from the surge in Omicron cases, and experts are expecting a flood of long COVID cases.
We are expecting to see a lot of people now who know that they have not recovered from their acute infection and needing that sort of validation that they've got long COVID now.
Anna Brooks will be speaking at a long COVID symposium next week, which is calling for government agencies to provide ongoing support for people like Ryan Johnstone.
It's a lottery as to how your immune system will react to the virus. You just don't know. There needs to be some sort of safety net there for them, because at the moment they're on their own.
A safety net to support people like him back to full health.
Well, kia ora, Lucy. As we heard there, experts projecting 200,000 of us could get long COVID. Is that a conservative estimate?
Well, Sam, estimates of the percentage of people that could develop long COVID vary between 10 and 30%. But our high rates of vaccination should keep us nearer the 10%. But that 200,000 only accounts for the current number of COVID cases that we have had. As our cases go up, so will our long COVID cases. And reinfection can also cause long COVID, even if you were OK the first time. The government is working on a long COVID framework, but for those already suffering, they need help now.
Our health correspondent, Lucy Warhurst. Lucy, thank you.